Welcome to the TOPx HHS Tech Sprint for AI and Invisible Illness Kickoff. I am Dr. Kristen Honey, and I'm thrilled to officially launch the sprint with you all here today. Thank you for joining us. The sprint is made possible by a dedicated team, next slide please, of leaders from across the Department of Health and Human Services, or HHS, as well as our participating partners with Lyme, the Stephen and Alexander Cohen Foundation, NIH, and the Federal CDO Council. So I want to take a moment to introduce the core team. So Dr. Stephanie Herodopoulos, Principal Deputy Assistant Secretary for Health, Jules Nimbatoke, FDA Data Scientist, Raven Richard, who's a Health Policy Analyst at the NIH, Patrick Carriel, Strategic Advisor and former White House Presidential Innovation Fellow. Also from our HHS Lyme contractor ensemble, we have a great contracting team supporting us. So thank you all to Ensemble, Alexander Barrera, Bailey Morton, Amanda Buchanan, and Oliver Gerland. Thank you all. This truly is a team effort with many more invisible helpers behind the scene. So our collective mission, including all of you watching today and all of the people who submitted to TOPx solutions and the 45 winners who will be announced today, our mission collectively is to use federal and government open data and artificial intelligence, or AI, to bring visibility and faster diagnosis to millions of Americans suffering with chronic conditions. Tens of millions of Americans live with complex chronic conditions, disproportionately affecting women. The result? Delayed diagnosis, fragmented care, and invisible human costs. These conditions are poorly understood and too often dismissed. No one should suffer for years without answers. So how might we use US open data and AI to turn fragmented signals into trusted insights, new insights, so people living with Lyme disease, long COVID, ME/CFS, and other chronic conditions are believed earlier and diagnosed faster? Sponsored by HHS in collaboration with NIH and the Federal Chief Data Officers Council, or the CDO Council, and the Lyme partnership with the Stephen and Alexander Cohen Foundation, we're putting US open data into your hands. And collectively, you are going to build the solutions. And the mission is to mobilize industry, entrepreneurs, innovators, problem solvers, communities, those with lived experiences, to build real-world tools to solve real-world problems, ideally using AI to accelerate the solutions. But open data is our foundation. And together, we will make invisible illness visible, measurable, and solvable. As you can see here, many of us have different solutions to these complex challenges. And we have broken these complex challenges into 3 tracks that are represented today. Next slide, please. We have Lyme innovation. And in this category, we have the theme that no one should suffer for years of uncertainty from a preventable tick-borne infection. So how might we use open data and AI to detect earlier, diagnose faster, and coordinate care to improve outcomes? Invisible illness is the second category. What we don't measure, we won't treat. And women are disproportionately affected and overlooked. So how might we use US open data and AI to make invisible illness visible and drive faster diagnosis, better care, and real-world impact? And then the third area that TOPx teams have been driving solutions for is the cost of illness. What is the true cost of these invisible illnesses? Patients and families carry the burden in silence. So how might we use US open data and AI to quantify the full impact of invisible illnesses and generate insights that make costs visible, measurable, and impossible to ignore? So with that, I want to thank our evaluation panelists. And I apologize, I don't have the slide forwarding on here. So Oliver, if you can just go with me, you have to run a show, just put me on the right slide. But I want to thank our evaluation panelists. We owe a huge debt of gratitude to the expert panelists whose rigorous evaluations and time ensured the integrity and impact of the sprint through a merit-based process that is online with radical transparency for all to see. We had people from the outside volunteer their time to review all the solutions submitted. So in Lyme Innovation, we have Duvi Honig, the founder and CEO of Orthodox Jewish Chamber of Commerce. We have Dr. John Ocott, Associate Professor of Medicine at Johns Hopkins University, Holly Ahern, Chief Scientific Officer and co-founder of ACES Diagnostic, Dr. Kara DeAngelis, Director of Research, Global Lyme Alliance, Dr. Artem Gorchorov, R&D engineer at UCLA. And I'm going fast because we have so many helpers, but this would not be happening without all of the people behind the scenes. In the Invisible Illness Evaluation Panel, we had Nevena Zubčevek, Dr. Nevena Zubčevek from Digital Health Strategy Consultant, Healthcare and Life Sciences, Bruce Patterson, founder and CEO, CEO, Health Bio, David Petrino, CEO and co-founder of One Phi Health, Devin Russell, CEO and co-founder of Long COVID Foundation, Susanna Rose, Director of the Center of Biomedical Ethics and Society and Healthcare Innovation and AI Ethics Leader at Vanderbilt, Sharon Forsyth, founder and executive director of the Alpha-Gal Alliance Action Fund, Jen Libby, youth psychotherapist with Promly. And in the third category, our evaluation panelists reviewing the submissions for cost of illness were Jonathan Ketchum, founder of Margin Health, Lorraine Johnson, CEO of LymeDisease.org and principal investigator of My Lyme Data Patient Registry, Stephen Kotler, executive director of Flow Research Collective, Tylana Cheryl Scott, chief economist of the Cherokee Nation Business, Tarlik Zahir, chief health advisor of Andromeda Ventures. So now we get on to the congratulations with all of our TOPx teams. And we proudly celebrate the 45 exceptional teams out of way more than that, out of 171 submissions. We had to down select from 45 and advance. These 45 teams are all phase 1 winners, and we'll be moving on to phase 2 to build with us in HHS over the next 3 months. And since launching on May 29th, we've seen extraordinary engagement. With 171 submissions, 145 of which met all the eligibility requirements. The quality of these concepts far exceeded our expectations. It was exceptional, and it represented a diverse community of startups, academic researchers, independent solvers, and the lived experiences that the TOPx experience really wants to pull out. So to select our winners, we used a rigorous process. Everyone was evaluated the same way. All of that rolled up. And then that 20-point score card on innovation, impact, and scalability. Following this, a federal judging panel reviewed those assessments to finalize our selections to move on to phase 2. And these are the 45 teams we'll be announcing, and 15 teams per track. These 15 teams, 45 in total, have all been selected to advance to the TOPx HHS Tech Sprint for AI and Invisible Illness full sprint. So they will be working with us for the next 3 months, really ambitiously. And over the coming weeks, you will turn all of these ideas into actionable solutions. All the minimal viable products, or MVPs, and ideas are now going to be turned into real digital tools and solutions, grounded in open data, technology, AI accelerated, and most importantly, the lived experience to address real world people needs today. So in this phase, we focus from concepts to building functional MVPs together, and let's build it. So the Lyme innovation winners, let's congratulate the 15 outstanding winners. And then here we have Karen, and I'm not going to go through the details. They're on the slide. All of these slides will be publicly available for everyone. Carwell, Ella Outreach, Evidence First, Geo AI, Lyme Early Care Navigator, Invisible Signal, Lyme Bridge, Lyme HQ, Lyme Sentinel, Lyme Signal, Lyme Signal AI from scattered clues to coordinated care, One Health Lyme Gaps Atlas, Sentinel Clinical AI Agents, Tick Test, Detect, Track, and Treat, True Signal Analytics, and those are our 15 on the Lyme team. We are moving really fast because of time. You will be seeing these teams again. What will happen now is they are going to form a cohort, and they are going to work together very, very closely in collaboration with the subject matter experts outside of government, as well as the data stewards from within government, to build out what they proposed. And then collectively, after 3 months, we will launch together in one big demo, a TOPx HHS demo, with a spotlight on all of these teams. The teams may combine. Some of them may have one piece of the puzzle, another one has another. So there may be fewer than 15 teams that come out the other side, but all of these 15 teams, huge congratulations to you. They are going to be moving on to phase 2 with us, and very excited to see what you'll build next. Next slide, please. On to invisible illness. The 15 visionary teams advancing the invisible illness track. We have the invisible half engine, beyond the diagnosis, Chrysalis health spaces, EndoRisk cardiometabolic platform, help for long COVID, IACI care, Lani hidden symptoms visible, LASA classical diagnostic delay gap, measure it to cure it, AI engine, Project Mask ENT quantification, seen making invisible illness visible. Slothwise, I love the name of this one, Slothwise, for pacing, for bringing out the wellness for some of these IACIs, long COVID, complex chronic illnesses. Slothwise, congratulations. The invisible patient finder, the phenotype cluster AI for multi-system illness, trial pilot, clinical trials for invisible illness from your phone, Zebra Path, turning hidden illness into actionable care. And then again, you will be hearing from these teams again. You'll be seeing these teams again. Today, we are just announcing that the 15 of them are going to be joining us for the next 3 months, working and transforming federal open data into digital tools, new insights, and then launching together as a cohort. So in November sometime, you will all see what has been built. We encourage these teams to get to know each other. There will be follow-up. They are a new cohort. They're going to all be working on different parts of invisible illnesses, and they'll likely learn from each other. And some of them may have pieces of the puzzle for each other. So our role in government is to provide a lightweight collaboration sprint for these folks to build their tools as quickly as possible, while getting their questions from government and the data steward answers and connecting them to the resources that are needed, whether externally with subject matter experts or internally. And we really looking forward to seeing all that you developed with the invisible illness track and the tools to come. Next slide, please. Cost of illness winners. Now, this one is this set of group is going to quantify through different tools that were proposed the full cost of invisible illness. So, congratulations to Bird and Bridge AI Health Atlas, DB Bun Invisible Illness Simulator, Cost Lens, making invisible illness cost visible, Diagnostic Odyssey Ledger, HealthWork, Impact Atlas, AI-powered cost of invisible intelligence platform, Pathway AI, economic burden, pricing the invisible, Sentinel, the quadruple deserts, Signal Bridge, cost navigator, TOPodx, visible burden index, visible burden AI, Waypoint Ledger. All of you are going to be joining us and helping us turn these invisible costs, these hidden costs, into what is not only visible and quantified, but will make it more actionable so that we in HHS can respond and improve with all the levers at our disposal, whether it's policy, grants, all of that. The input and the outputs from this TOPx Sprint are absolutely going to be funneling up to the highest levels of HHS government. That really is giving so much support and top cover for chronic illness, Lyme disease, alpha-gal, invisible illness, women's health, so many areas, and now also the cost of these invisible illnesses and the full cost of illness. And with that, please let me introduce a distinguished leader who is championing all of these efforts from HHS headquarters to combat Lyme disease on a national scale. And beyond Lyme disease, also alpha-gal, autoimmune diseases, women's health, children's health, all of the MAHA agenda and public health priorities are being led by Dr. Stephanie Herodopoulos. We will now play a short video where Dr. Stephanie Herodopoulos, the Principal Deputy Assistant Secretary for HHS and the Director of National Health Communications, she recently spoke at an event when Robert F. Kennedy, the HHS Secretary, announced new actions to combat Lyme disease. And following this short video, we are thrilled to hear directly from Dr. Herodopoulos. So with that, thanks for the video and welcome all. Thank you for being here.
nation. 31 million people get bit by ticks per year in the United States. Not all of them get, of course, Lyme disease, but we know 500,000 do. And that's maybe underestimated because we need better biomarkers. We also need better innovative treatments. And we know that now 20% of those people that get Lyme disease go on to chronic persistent Lyme disease that has autoimmune dysfunction and inflammation in their body that could take years to rectify. And that has got to change. I want you to know we see you, we hear you. We're going to make the invisible diseases visible now through Secretary Kennedy's leadership and President Trump. We are all hands on deck. We want to cross-cut across all agencies, break down the silos, have radical transparency, and get everyone on board. What we just announced are huge and have been years in the making. You can find this on hhs.gov/Lyme. You can find the clinician locators. You could find all the prizes and challenges, the memorandum of understanding with ILADS, and all the information from the CDC that started their new campaign, No Time for Lyme, starting May 1st. Please look at the website. You have chock full of information. We know prevention is key. We could prevent not only Lyme disease, but all the co-infections that go with it. And I want everyone to recognize that you can have multiple infections at the same time from a tick. It's not just unilateral. So
Wonderful, Dr.
Well, thank you for that introduction, Dr. Honey, and that video. It's so hard to watch yourself back on a video, but thank you for giving me the opportunity to talk today in this amazing announcement with the next phase. So I just want to say, as a physician, I have spent many years diagnosing, trying to, and treat people with Lyme disease, and I know from the real world experience that could be so frustrating in clinical practice. But we often see patients that have been suffering for years. And I know I'm speaking to the choir with the people that are on the call today, and they've lived this experience. It's so real to them, and the pain is real, yet they are often met with silence, skepticism, and dismissal. And this administration's trying to change that trajectory. Sometimes we allow dogma over data, and we really hope that now there will be a paradigm shift with that. Sometimes in scientific research, we call it snow. It's a metaphor because we have to define it. And so I charge all of you with defining the snow, because you are going to change the future where people will not have to suffer like you have, or you've seen your family members, friends with this challenge. That is why the phase 2 kickoff is so significant. And we are moving from conceptual ideas now to functional MVPs, and we are choosing that data over dogma. We're leveraging the full weight of US Open AI data sets that have been sitting in federal silos and giving them to you to put into your hands for those who need it the most. We're using AI not just as a buzzword, but as a diagnostic multiplier. You are the engineers and builders. You're going to turn those fragmented statistic numbers into dynamic, reliable roadmap of care. By bringing rigor and evidence and transparency to the next data sets, you are building those tools that will finally force the medical community to see what we have been seeing hidden in the plain sight. And this is how we move from skepticism into evidence. And this is how we go from invisible to visible. This is how we move from fragmented patient journey to coordinated proactive care. So as you enter this sprint, I just really want to challenge you to maintain that connection to the human being that is at the center of the data. Every data point represents a person who is waiting for answers. Keeps your work patient-centered, please, and ethical and ambitious. We know you will. You were selected because you proved your concepts could bring the gap between invisible and solvable. Now it's time to build. We are looking forward to seeing the MVPs, and we are honored to support you as you turn these ideas into real-world impact. Thank you so much for your commitment to work, and I look forward to seeing how this all fleshes out, and let's get building together. Thank you, Dr. Honey and Oliver, for the time today.
Wonderful. Thank you so much, Dr. Herodopoulos. So going forward, we will look a quick introduction to TOPx just to orient all of you. Of course, you have a good understanding of TOPx, but we just want to really frame this in what the next few weeks will look like. We will go over the sprint expectations and kind of the key dates and milestones. And then we also have two guest speakers who we are thrilled to introduce at the end of today's session. And then we will close with some next steps, including what to expect next week, because we will be getting going very quickly, and we are really excited for the next steps. So with that, as likely you all know, the Opportunity Project, or TOP, and its extended model TOPx, is a federal open innovation program that turns government data into actionable public tools through collaboration with experts, designers, researchers, and communities. It operates as a rapid product development sprint, but it's focused on the nation's toughest challenges, from the opioid crisis and disaster relief to improving workforce capability, economic opportunity, and mission-critical service delivery. It's been used widely. There's been over 3,300 sprint participants, 280 digital products created. Of course, we're going to have to update that number after this series of sprints. 30 federal agencies, 450 data sets leveraged, and many universities and other collaborators. I do want to hit on one of the most important themes that you heard from both Dr. Honey and Dr. Herodopoulos, which is really this push to break down silos. This work matters because we are expanding the solution space involving all stakeholders. This includes academic and research institutions, public health and related communities, health technologists, patients and caregivers, healthcare institutions, providers, and really we are aiming to break down the silos and make sure that data flows and that patients are at the center of every solution. So again, we will go through a series of milestones. Each week, you will be asked for effectively some homework, some work to do each week, beginning with user research, then data exploration, then beginning your concept pitch, then the first major milestone will be the alpha demo. That will be then followed by a beta demo, and then finally the MVP demo showcase, which is where you will be presenting to evaluation panelists and judges. And then we do want to emphasize that customer and user feedback is critical at every single milestone along this sprint. So let's go over the expectations and really what you can expect over the next few months. So again, I want to frame what we're trying to achieve at a broader level. We are here to make invisible illness visible with data, AI, and American innovation. Teams are going to be building a variety of different technologies and solutions. These could be things like detecting care earlier, coordinating care, making burdens visible, and of course, our expected outcomes are to catalyze real-world MVPs, AI-enabled tools, and actionable insights that make the invisible illnesses visible, measurable, and solvable. That's why we're here today, and that's what we're focused on. As Dr. Honey mentioned, and all of you are aware, we have our three main challenge focus areas, and all of this underpins our goal to demystify government and help people navigate access to US open data across these three primary focus areas of Lyme innovation, invisible illness, and cost of illness. All of you have responded to each one of these prompts in such a powerful way that you've been selected. So again, I want to say congratulations. And thank you for tackling each one of these important focus areas. I want to frame again where we are right now as we progress into phase 2, the TOPx Sprint, where your exercise now is to transform your concepts into functional MVPs. Luckily, there is great incentives to do this. It's going to be a lot of work, but there is up to $2 million in cash prizes, including one grand prize of $1 million. Three first place prizes of $200,000 each, and that is per track area. And then again, three second place prizes for per track area of $50,000, 15 impact awards of $15,000 each. And then there will also be a 5 People's Choice prizes where the public will be able to vote on their favorite ideas. All of this is being executed under the America Competes Act and official challenge rules on the NIH.gov website. And we also do want to say that there could be additional recognition, and HHS may at its sole discretion provide non-monetary recognition such as honorable mentions or similar acknowledgements. So let's look at the timeline. We are just now into phase 2, the TOPx Sprint, and kicking things off. This will progress until October 22nd. And then the sprint phase will close, and we aim to announce the winners at the end of October with an event in early November to celebrate the winners. So just again, this is from the challenge rules. You've probably seen this, so I'll go very quickly. But at the end of phase 2, when you do your final MVP demo, you will be asked to provide your final submission package and demonstrate your minimum viable product. This will include an overview of your solution, the core functionality and the intended use. We will ask that you provide a live demo, a prototype, and/or working product. These could be things such as an app, a data or AI solution, visualization tool, perhaps a backend integration tool. We will also want to understand how your submission fits into the 4 evaluation criteria, and those are framed as the results for the American people. So we'll ask you to identify the target user and show how the solution fits into a real-world workflow. We will also ask you about the data tech and understand the evidence behind your approach. So we'll ask you to explain how your solution uses US open data and/or other data sources, and if there is any interoperability or integrations as well, that will be very important to call out. We will also look at the execution efficiency and delivery. So we will ask that your submission includes a description of the value your solution delivers. Is it improved insight? Is it improving decision-making, care coordination, improving efficiency, enhancing return on investment? So that will be another element in your submission package. And then finally, we will look at the scalability, reuse, and societal impact. So we will ask you to explain how the solution can be deployed, scaled, and adapted, including key assumptions and next steps. I do want to briefly touch on the judging criteria. It will be very, very similar to phase 1. It is leveraging both a non-federal evaluation panel composed of the same interdisciplinary experts used in phase 1, as well as a federal judging panel who will be taking the scores and other qualitative assessments and feedback to make the ultimate determination on winners and awards. All of this can be found on nih.gov/challenges. So again, familiarize yourself with the challenge rules if you have not recently. It's just a good practice for sure to understand the kind of key criteria, because that is the information that our team is executing on. So again, just to familiarize yourself, this is our evaluation panel criteria. This is the criteria that will be used to evaluate your phase 2 solutions. Again, it should look really similar. It's the same criteria used in phase 1, but here we are looking more to judge the proof. And the evaluator's mindset is a little bit different now. They will be asking, did this team deliver something functional and useful instead of propose or concept? So those 4 criteria, each with 5 points, include results for the American people. Does the concept address a real user need, patient pain point, care gap, or data gap? Again, the data tech and evidence-driven innovation. The panelists will ask, is there a credible plan to use US open data, AI, tech, standards, and evidence? execution, efficiency, and delivery. Is there a realistic path to a functional MVP with near-term real-world utility? And then scalability and reuse and societal impact. Could the idea adopt across conditions, populations, agencies, or policy contexts? So again, this is a 20-point scorecard across those 4 criteria. And this will ultimately help the federal judges make the ultimate determination. So let's get into the sprint and what the kind of rhythm of the sprint looks like. So this is where you transform your ideas into the functional and useful solutions. As we've mentioned before, this sprint is grounded in human-centered design principles. So it's always a build with and not build for attitude. So we begin by understanding the real user needs. Then that gets layered into leveraging the US open data sets. And then those get combined to create the alpha, beta, and final live demo concepts. So how will we provide support? So each one of the tracks has dedicated personnel to support you. You'll have an ensemble sprint lead who you've likely been emailing already. And there is also going to be a dedicated federal subject matter expert who will be supporting each track to provide insights on the data sources and on other important elements that our sprint lead might not be aware of. So for each track, there's 2 dedicated personnel to work with you, and there will be weekly office hours that you can jump in. Not every weekly office hour will be mandatory, but it is a great opportunity to get some questions answered, to perhaps propose or show an early concept and get some feedback. We also will have the pre-scheduled progress check-ins that lead up to the alpha, beta, and final MVP demo. We, of course, will be recording these milestone sessions and providing feedback. And in general, you can reach out to us. We are open, we're transparent, we are here to help you. So I would recommend reaching out to your sprint leads with key questions. And we're really, dedicated to serving each one of you as a team and getting you the best answers to data resources or other insights. This also includes creating a group of patient advocates. So there are also going to be some patient advocates that we could connect you with, who you could interview or connect with to gather additional insights. We would welcome you to, go and engage other patients and users yourself, but we do also want to be able to provide some patient advocate so that those insights can flow to your team. So, what does great look like at the end of the sprint? Well, we would love if each one of you has a clear target user, a refined problem statement that user faces, a defensible data strategy, leveraging US open data and advancing a solution for that target user, a tested product direction, and a compelling MVP demonstration. If you had all of those at the end of this sprint, that would be great mission success. So let's walk through the actual sprint pathway and the 6 major milestones. So user research is where we begin, understanding the users, defining their problems. Next, we will move into data exploration, exploring data sets and refining the scope, understanding how that data and that user research can be embedded into your solution. That will then move into the concept pitching. We will be interested in various solutions or concepts that leverage those first 2 elements. And then we will ask you to present a low fidelity alpha demo. This is going to be a closed cohort, not open to the public. So it really is an early, concept. And then we'll go through a feedback round. You will do it again via a beta demo. Again, a closed cohort demonstration. And then finally, we will go through the MVP demo, which will be public, which is where your ultimate solutions will be demonstrated and where your solutions will be judged and evaluated. So again, we have our weekly office hours, scheduled progress check-ins, and then our milestone demonstrations. And each week will be dedicated to one of these, achieving one of these 6 milestones and doing the sprint work. So Here's how the sprint story builds. We start with evidence. We narrow the direction after diverging in terms of the solution space. And then we, of course, want to prove the usefulness of these real-world solutions. So in user research, what will teams be doing? Well, first, we would ask you to identify your target and user. Reach out to at least 3 users and document their challenges, pain points, goals, and barriers. And the first element is drafting a problem statement grounded in what you learned. So on this, you'll be supported by user advocates, the data stewards, and the sprint managers. And we would ask that your problem statement incorporate the insights that you've gathered regarding the user's challenges, pain points, goals, and barriers. Then in the next milestone, we will be focused on data exploration. So we will be reviewing all of the available open data and related resources, we will be looking for you to ask us questions about the data so that we can provide in-depth answers. We will work together to determine which data sources fit the scope, and then we would ask the teams to refine their problem statement using those data elements. So the milestone output here would be, what data did you explore? What lessons did you learn? And then what data source is actually being leveraged in your MVP? And how might this have refined your problem statement? So again, we'd want to move from a broad idea to a defensible data strategy. Next, the concept pitching. We would ask teams to identify multiple potential solutions, compare ideas for feasibility and impact, create quick representations of the solutions, gather some user feedback, and basically explore the solution space with 3 concepts: early wireframes or sketches, rationale for your direction, and then if any user feedback has validated or changed your approach. Again, we are looking for many different creative solutions at this milestone concept pitching phase. And then we want to move into the alpha demo, which is where you will focus in on a specific solution, present a 3-minute low fidelity concept demo, show the target user and the workflow, explain the data and AI tech approach, and then this will really help surface any open questions, risks, and of course, our team will be there to provide you feedback. So this will be a 3-minute lo-fi presentation that clearly defines the problem and the solution. And again, it's a good opportunity for the user advocates and data stewards to provide feedback. We will go through that iterative round of feedback another time. So then we will give you another set of 1 to 2 weeks to refine your prototype, test usability and desirability, and iterate. Then we will ask for a high fidelity demonstration, again 3 minutes, providing evidence of any testing or feedback, and hopefully improving and closing some of the gaps before that final demonstration. Then we will come to the final live demo, which is where everything comes together and we see all of the amazing solutions that you've built throughout the sprint. And again, this is going to be a public event where judges, evaluation panelists, other stakeholders, many people across government, inside and outside government will be very interested. So I'm really excited for this final live demo. All right, let's go over some of the dates. So right now we have defined some of the key demo times and really when we aim to make awards. So today is the sprint kickoff. We'll go over the kind of next immediate milestones, but just to call out, the alpha demo is scheduled for September 10th. The beta demo is scheduled for October 1st. The final live demo is scheduled for October 22nd. Then from there will be reviews and determinations. And then finally, we will be announcing the winners and also very likely inviting them to a special event held on November 6th. And after that, also prize payments will flow. And then finally, during that kind of review and determination, the People's Choice Awards voting will also be open. And that will be through November that there will be voting. And then those prize payments will also flow after that time. So, first, what's our plan for next week? Let's get started. We have scheduled introductory sessions. Very likely, all of the sprint managers or sprint leads from Ensemble have reached out to schedule. And this intro session is where we are looking for you to introduce your team and also provide us an early pitch. Just show us what you've got. Of course, we expect, it doesn't need to be perfectly polished or anything like that, but we're curious. We want to hear what you're thinking, what you're working on, and provide feedback. So these will be approximately 3-minute pitches, and then we will also give the opportunity to give direct constructive feedback from the sprint lead and also from your peers. So Lyme innovation right now is scheduled for August 18th, and then invisible illness and cost of illness is scheduled for August 20th. And again, your sprint managers who you've been working with will help you and make sure that you're scheduled and get all of those on your calendars. So that's the next big thing for next week is this team introductions, early concept pitch, and really just to learn what everyone else is working on. Again, just at a high level, so that collaboration, feedback, and all of these very important things can occur. Again, because of the kind of complexity of running 3 tracks, how we are designing this is that each one of the tracks will have their own dedicated demos. So the cost of illness on September 10th will be from 11 to 12:15. Invisible illness will be 1 to 2:15. Lyme innovation 3 to 4:15. Similarly, the beta demo on October 1st will follow a similar time frame with cost of illness 11 to 12:15, invisible illness 1 to 2:15, and then Lyme innovation 3 to 4:15. And then this final live demo, this will be a larger event, likely longer in time because we're still basically defining the exact structure, but this will be one webinar and it will likely move into 3 breakout rooms for each of the different tracks to make their final live demonstrations. But this is subject to change. This is how we're thinking about it right now. And again, we're really excited for that final live event. So with that, I will pass it over to Brandon Brown, who is the Chief Data and Analytics Officer at the U.S. Department of Labor, to talk about the importance of using U.S. open data sets to tackle these important challenges. Brandon, the floor is yours.
Okay, thank you, Oliver. Good afternoon, everyone. Welcome and congratulations to all the participants on making it to phase 2. This is a very exciting program. So my name is Brandon Brown. I am the Chief Data and Analytics Officer at the U.S. Department of Labor, and I'm here today as a representative from the Chief Data Officer Council, who is co-sponsoring this project. I've also been an admirer of the TOPx program and have been fortunate enough to have been at the first TOPx Sprint, which is coming up on its 10-year anniversary now. The great thing about TOPx is it's very simple, and there's a lot of flexibility for solutions to come from anywhere. One of the things that I think is really incredible about the power of US open data and how that translates into this project is that it's really going to challenge you to transform fragmented signals from these federal repositories into trusted, actionable insights for the public. US open data is a fantastic strategic asset. The foundation of that for this project is obviously in healthdata.gov, which is a great source for transparency and cross-agency collaboration, not just the technical resource. I want to give you a quick overview of the council, how it operates, and how you can ensure that your sprint activities are in alignment with the broader government impact that you seek to demonstrate through these credible tools. The Chief Data Officer Council is comprised of all the CDOs across the federal government, but also we're broken into 3 work groups. Each work group is tasked with developing projects that are furthering the goals of the federal data strategy and the president's management agenda. The 3 work groups are Accelerating Data-Driven Government. That is the work group that I co-lead that is specifically sponsoring this HHS Tech Sprint. The idea there would be to move beyond just collecting data into actively using it to solve the nation's toughest challenges like Lyme disease and long COVID. The second work group is called the Optimize the Business of Data Working Group. This group is tasked with ensuring data is interoperable, accessible, and high quality so that innovators like you can build scalable solutions without fighting through red tape. And finally, the Enhanced Customer Experience Working Group. Ultimately, every data set we open and every tool you build must improve the lived experience of the patient, the clinician, and the caregiver. And now I just want to take a moment to go over again the rules of TOPx. Next slide, Oliver. Thank you. Open data. This is crucial. You must use at least one U.S. federal open data set or federal data standard. For example, PubMed literature library counts. It must be user-centered. Put citizens and users at the center of the design and iterate with them. Third, build new actionable solutions. Build a new product or add new functionality to an existing tool. And just a couple of reminders for you as you move on into phase 2. Don't forget about the human element. As you get deeper into the technology, the AI, the data, remember that data is a proxy for real life events that represents human lives, and maintain a focus on the real world impact of that technical work. Also, please ensure that you are treating data as a strategic asset through the documentation, awareness of limitations, and prioritizing responsible AI. Use specific tracks, the 3 tracks that have been identified through the sprint: invisible illness, Lyme, and cost of illness, at healthdata.gov to ensure that your outputs are grounded in evidence. I just want to say what an honor it is to be a part of this project. I can't think of a better fit for data as a strategic asset than the concept of making the invisible visible, because I've long believed that is one of the fundamental and foundational value adds of data. So this is such a perfect fit, and I'm really excited to see where this takes us. So good luck to you as you use data to build a healthier, more measurable future for everyone. And we, as the rep for the Chief Data Officer Council, just want to remind you that we are your connection to the federal data community, to federal data stewards and subject matter experts on these data sets that you will be engaging with. So please feel free to reach out to us. And I'll turn it back over to Oliver. Thank you.
Wonderful. Thank you so much. Our next speaker is Lorraine Johnson, JD, MBA, and CEO of LymeDisease.org. Lorraine has spent more than 2 decades working on Lyme disease, first as a patient who progressed to chronic Lyme, first as a patient which progressed to chronic Lyme, then as a leading patient advocate and data expert, building much of that expertise at PCORI's National Patient Registry Network. She also founded MyLyme Data, the largest patient registry in chronic Lyme disease, with more than 20,000 patients and 8 peer-reviewed publications. Please join me in welcoming Lorraine Johnson.
Thank you for that kind introduction. Today, I want to talk about the hidden costs of chronic Lyme disease and what the data misses by drawing from public research using MyLyme data and then comparing that with the 2026 JAMA study on cost of illness. Where did that study get it right and where did it fall short? First, a little about me. Next slide, please. As you just heard, I've spent more than 20 years in Lyme disease, both as a patient and advocate, and through my work with PCORI for its patient registry initiative, serving on PCORI-Net's executive committee, and now through the MyLyme Data Patient Registry, which has enrolled over 20,000 Lyme patients and published 8 peer-reviewed studies. Next slide, please. About 500,000 people contract Lyme disease each year. Even when diagnosed and treated early, 20 to 30% go on to develop chronic Lyme. A recent EHR study, which we'll talk about in a minute, puts that number at 22%. In 2018, DeLong estimated 2.2 million Americans were living with chronic Lyme disease. MyLyme data studies show that most chronic Lyme patients see 7 clinicians before getting diagnosed. Misdiagnosis and delayed diagnosis are common. And these are sick people. More than 70% rate their health status as fair poor, compared to just 16% of the general population. And they're 4 times more likely to report being disabled from work, 28% versus 6%. 29% have changed their work hours or role. Half say their care isn't covered by insurance. Instead, they're paying out of pocket for specialized care that costs more and takes more time. 46% have been ill for 10 or more years. Next slide, please. A new JAMA study by you using EHR big data estimated Lyme disease costs up to $1.05 billion a year, just in 15 high-incidence states. Disseminated or late disease, which accounted for 22% of cases, drove nearly 70% of that cost, $6,833 per patient, about 10 times the cost of acute care. This is valuable data, to be sure, but it undercounts the true burden in 4 ways. It's built on EHR data, which excludes the uninsured, but in MyLyme data, half of patients say their care isn't covered by insurance. And 75% of clinicians who specialize in chronic Lyme don't accept insurance or Medicare. It assumes usual care settings and costs, but chronic Lyme specialists don't work under a 15-minute insurance model. Visits are longer and costs more. The study only covers 15 states, but Lyme doesn't stop at a state line. And it counts only direct medical costs. But a study by Zhang at the CDC found 54% of the total cost of illness for chronic Lyme disease is lost productivity, work missed, hours cut, and careers derailed. Next slide, please. This is the picture I want to leave you with. The real cost of chronic Lyme disease runs far deeper than any single data source can show. To see it fully requires combining several data sources, including patient-reported data. These costs must include what insurance doesn't cover, what specialty Lyme care actually costs, data from every state, and the cost of lost productivity. Thank you for taking the time to dig into this with me today. MyLyme Data is a data steward for over 20,000 patients, partnering with organizations across the Lyme community. We also collect patient-reported cost of illness data using standard government survey measures. We might have a piece of the puzzle you're missing. If you're interested in working with us or want a copy of this slide deck, please contact me at lbjohnson@lymedisease.org. Next slide, please. Next slide, please. That's my final slide.
Thank you so much, Ms. Johnson. So finally, we will just go over some next steps and then, of course, some closing remarks. As for next steps, just a sprint reminder to confirm the schedule. So take a look at the scheduled office hours as well as the upcoming milestones. Block those on your schedule. You should be receiving invitations. And also after this call, there will be some follow-up emails with additional documentation and guidance. Of course, the next important sprint sprint element after the team introductions and early concept pitching will be the user research. So identifying your target end user and beginning outreach to those users. Then the first milestone, documenting what you've learned and drafting that focus problem statement. And of course, we encourage you to ask early, leveraging the sprint managers and program support. So this is the key next steps that we will ask you to do over the next week. And with that, I will pass it back over to Dr. Honey.
Thank you so much, Oliver. And as we conclude today's kickoff, I just want to thank everyone who has participated in the TOPx HHS Tech Sprint for AI and Invisible Illness. With over 171 submissions, we could not bring in all the great solutions. There were so many wonderful ideas and concepts and submissions, and you are all still part of the solution. These teams are going to be building. We're going to need outside expertise. If you want to be involved, please let us know and we will find a way. This TOPx momentum is continuing and we want to be open and inclusive to all of us. So thank you to our speakers today. Congratulations to all the phase 1 winners, and I look forward to seeing everything you're going to do in phase 2. Special thanks to Dr. Stephanie Herodopoulos for her leadership at HHS headquarters, Lorraine Johnson for the Lyme data and leadership in the Lyme disease space, which is a great example that is also being done in other fields like long COVID. And at future events, we will be featuring similar speakers from other invisible illnesses. Brandon Brown and the Federal CDO Council and all of your support, all of the evaluation panelists. We could not do this without your support behind the scenes. And Ensemble and Oliver Gerland and the entire LymeX contractors team, thank you. So congratulations again. We are just one step closer. The next step, phase 2, is when the real building begins. And together we are going to make these invisible illnesses more visible, concrete, actionable, and eventually solvable. So thank you for being a part.
Thank you everyone so much. Have a great day.